To get started. Thank you all for being here. My name is Arlen Benjamin Gomez. I'm the Executive Director of EdTrust-New York. We are a statewide policy and advocacy organization that works to eliminate gaps and equities in our school system, particularly affecting Black, Latinx, and other students of color and students from low-income backgrounds. You can't hear it. Oh. Okay. We do this work through a combination of data and research and exposing the inequities in the system, and then developing policy solutions and advocating for those policy solutions on a state level. We do this work in partnership with stakeholders and other organizations throughout the state. This work that we're presenting today has been done with our Raising New York coalition, who have been pivotal in doing this research to expose what we're going to talk about today of the barriers that families face in accessing our child care system and our child poverty reduction programs statewide. As I said, as I read the report, it's great that we have a system of childcare and poverty reduction systems, but if families can't access it, I don't know what we're actually doing. So before we get started, I wanted to say a couple shout outs and thank yous to folks in the room. Some of our funders are here. Pritzker Children's Initiative has been pivotal in supporting this work. Wouldn't be possible without their support. We have the Altman Foundation here as well, who supports our education, early childhood education parent policy and advocacy lab. We have a couple parents here today from the lab, Amy, who will be speaking on the panel. We also have Delucy in the back, who are part of that program. And of course, the Robin Hood Foundation, who is not only hosting us here today, but pivotal in our partnership on child poverty reduction. So lastly, I want to acknowledge we have a couple elected officials who are with us and staff members who are with us virtually and in person. Senator Roxanne Prasad, the chair of Social Services Committee, is with us virtually. We have Alexa Arechi, the chief of staff for Assemblymember Andrew Havesi here, and Brian Romero, the chief of staff for Assemblymember Jessica Gonzalez Rojas is also here. So with that, we can get started. I'll kick it over to Jason Cohn, who's the Chief Policy Officer here at Robin Hood Foundation.
Thank you, Arlen. Hi, everyone. Just some quick remarks. And first of all, thank you for being here. Apologies, a little warmer than we would like. So we'll definitely have to keep the doors open and things like that. But as Arlen mentioned, I'm Jason Cohn. I'm the Chief Public Policy Officer at Robin Hood. It's really wonderful to see so many of our partners out here. And the work that's going to be discussed today is really important to Robin Hood, not just as a funder, but just the way that work was very centered in the experience of both the people doing the work as it pertains to children and families, and then also those children and families themselves. And I think we're you can see in some of the analysis there, we have a system that really has neglected that point of view, and that's why we're here today, right? It hasn't centered the people that the policies are supposed to benefit in the way that the solutions are crafted. I think that's very important. We talk a lot at Robin Hood about data driving things, but experience is just as important and is just as valued, and something that we really care deeply about. I know for myself, I've learned a lot over the last few years from this Raising New York coalition, the work of the partners. It's really helped our policy team, which was only really started in 2019, understand these issues. We learn from you as partners, and we're just really grateful to be in this work. We know it's a critical year with the Child Poverty Reduction Advisory Council completing its work. It's a very important moment where political leaders are going to have to make decisions about where they stand. Do they stand with New York families who need their support or not? And it's really that simple. They can either be on one side or the other. They have to pick a side. They have to stop getting off get off the fence and make the investments that are called for. And really it's a pleasure for us to have such an esteemed group here today to talk about these issues, to dig into them and continue to inform our work. So thank you so much. We're really humbled as Robin Hood to be able to host you all for the next few hours. So thank you. And over to Lara to sort of set the stage for us.
Good afternoon, everyone. So great to see so many familiar faces. And for the unfamiliar faces, I'm Lara Kiriakou. I'm the Associate Director of Early Childhood Policy and Advocacy at EdTrust-New York. And I'm here today because throughout all of my experiences in childcare, community-based programming, policy, research, I learned time and time again how brilliant infants and toddlers are. And I want to live in a world where families have every opportunity to live safe, healthy, educated, housed, and nurtured lives. So before we start our panel discussion today, I'd just like to take a couple moments to give a brief overview of the history of our early childhood work and what's led us to today's conversation. The EdTrust-New York launched the Raising New York Coalition in August of 2019, thanks to generous funding from the Pritzker's Children Initiative. Raising New York is a cross-sector, statewide coalition of early childhood, parent, business, health organizations dedicated to advocating for policies and system changes that will benefit families with young children with an explicit focus on improving long-term outcomes for children in low-income households, for children of color, immigrant families, and others who are furthest from opportunity. One of the many things that I know brings all of us together today is our shared conviction that the first 3 years of life are an incredibly important time for growth and development. And as such, young children are extremely susceptible to the negative and damaging impacts of poverty, which we know continue to disproportionately impact and harm Black children, Latinx children, immigrant children, children with disabilities and learning differences, and others who are marginalized. We are committed to strengthening early childhood systems so that every single child in New York, no matter who along most vulnerable, grows up with the support and resources they need to reach their full potential. We cannot do that without the voice, expertise, and leadership of parents, foster parents, grandparents, and other primary caregivers who know their families best and know how they need to get their needs met. This report, I'm excited to say, contains data from more than 1,000 families across New York State. They've talked about their experiences engaging with early childhood and poverty reduction programs. They've talked about how those experiences leave lasting impacts on their families. And they have recommendations for us to make these systems more accessible, equitable, and effective. I'm incredibly proud to be part of this work and grateful to our partners, the Adirondack Birth to Three Alliance, ECE on the Move, Help Me Grow Long Island, New York Immigration Coalition, the Children's Agenda, and the Schuyler Center for Advocacy Analysis, who have been on this journey with us for a year and a half and have worked so hard to ensure that the parent voices in their communities are heard and uplifted. So I'm very excited to get this panel going, and I would like to introduce this fantastic group of folks with us today. Our conversation will be moderated today by journalist Sarah Carr. Sarah has been reporting and editing for the Hechinger report since 2011, currently with a focus on early childhood education. She also directs the Spencer Education Journalism Fellowship at Columbia Journalism School and is a fellow at New America. She's written for the Washington Post, The Atlantic, and Slate, winning several national awards. So glad that you're joined us. Thank you. Shanita Bowen is the Chief Operating Officer of ECE on the Move, a grassroots organization advocating for family child care providers and the parents they serve across New York City. She focuses on parent engagement, documenting the child care experiences of parents of trying to obtain care, and informing policymakers where systemic changes are needed. Known for her strong advocacy, she highlights the lack of childcare investments and fights for access, affordability, and fair compensation for early childcare educators. So glad to have you with us. Amy Lee Funes is a parent. She's a former social worker in New York City who left her career due to the lack of affordable childcare options in Queens as a single mother to a 5-year-old. Amy has connected with parent organizations such as Parent to Parent and Parents Together, and participated in our very first inaugural cohort of the EdTrust Early Childhood Policy and Advocacy Lab, which you'll hear a little bit more about later. Welcome, Amy. Dr. Liz Isaacson is the executive director of Docs for Tots and Help Me Grow Long Island. She's a pediatrician and has extensive experience in public health with a focus on early childhood systems integration in health, education, and family support. Her advocacy for early childhood systems integration is driven by her exposure with the long-term impacts of underfunded systems on young children and families. She also leads Help Me Grow Long Island, which connects families with providers and educators to community resources. Welcome. So glad to have you. And last but definitely not least is Liza Schwartzwald, who's the Senior Policy Strategist at New York Immigration Coalition. Liza works on early childhood education and care, adult literacy, and two-generation work, and works to uplift educational opportunities for immigrant families and English language learners in New York in a holistic and integrated way. Welcome. All right, and we're off and running. Thank you.
All right. Well, thanks so much to Education Trust New York for convening us and for the important findings outlined in this report, which is really holistic and comprehensive in its look at the barriers that families of young children face in accessing all kinds of vital support. And thank you especially to our panelists who've taken time out of busy schedules and lives, and each of whom brings a unique and truly essential lens on these issues. And I want to dive straight into questions and start with you, Shanita and Amy, and a focus on childcare. Shanita, you have seen a number of home-based programs close since the pandemic. More than half of New York is now considered a childcare desert for families. We know that one-time workforce retention grants were helpful, but not nearly enough to sustain the workforce indefinitely. What does New York State need to do differently?
Thank you for your question.
Can people hear
Wait,
Shanita?
Just stop pressing for a second. It's going to go solid.
We'll keep going.
Oops, sorry. Okay. Now it's working.
There you go.
Now it's working. Now it's working. Oh, now it's working. Okay.
No.
Sorry, time wasting, clock ticking. Okay. What was the question? Okay, no, serious. What New York needs is to invest in childcare, invest in the workforce. Plus, that's it. When you invest in the workforce being small business owners, family childcare programs, the center-based programs, all modalities. When you invest in us, you are investing in the children. When you take care of us, you are taking care of the children, especially for those who are serving those who are economically not as privileged. As if I can take a second to say that my program closed during the pandemic because I fell through the cracks. I was serving for 16 years, got married, moved, and no one told me that what I could do to stay open. Cracks. Should be no cracks in someone qualified as myself, CDA, very well known in the community, taking pride in my program, that I had to start over as an informal. I just fell through the cracks. I couldn't prove that I could have stabilization funds. There should be no cracks, and we have to invest in the workforce.
What could have been done differently to allow you to stay open? It came down to not getting the right information about stabilization funds.
What it boiled down to was a system that wasn't working. None of the agencies were open when the pandemic hit. Everyone abandoned us. I'm going to say abandoned because when you're calling your state office, when you're calling your licensing office, when you're calling your union, when you're calling, making calls to find out, what am I doing? This is a pandemic. Everybody's closed. What are we doing? We have to accept children. No one answered us. So that's how I fell through the crack. Many fell through the crack. And yes, many doors are closed and many doors are still closing. Our founders, Gladys Jones and Doris Irizarry, helped start the family childcare chapter in the UFT. And there were 25,000 family childcare providers strong. We are down to, if I'm correct, over 5,000 family childcare, or we're not where we were. And we're continuing to close. We organize over 600 providers, and every day we hear they pull us to the side and say, we can't do this anymore. We can't keep fighting for a budget that's never going to happen.
Thank you. Amy, you've experienced the childcare dilemma as a parent. If you think back to a particularly challenging time, what were some of the specific obstacles you faced, and what kinds of help or resources would have been most useful to you?
Hello, you're good. Thank you. Okay, so back in 2019, that's when I had my son Leo. And so this was right before the pandemic. When I had him, I was actually working for a nonprofit agency, and I was making $35,000 a year. So not a lot, right? Very modest. I was looking for childcare subsidies, and first off, I was sent to many different places. It wasn't clear. One person said, go to this office. The other person said, oh, ACS does it. So I went to ACS and they said, no, only if you have an open CPS case, go here. So I went to a bunch of different places. So first, just the beginning was very confusing. Finally, I reached HRA, and the woman met with me, and she said, I know you don't make a lot of money. I know $35,000 a year is not a lot, but it's too much money to receive childcare subsidy. So your only other option would be to leave the workforce. So I've been working since I was 15. So to hear this, I was like, what? So I did that. I left my job so I can get on public assistance, because she said the only way you can get the subsidies is if you go on public assistance. So then I had to go on public assistance to receive cash assistance and food stamps, right? To get this voucher. So, okay, so now I have this voucher. At this time, I temporarily had to relocate to Harlem. And so I was looking for childcare in that area. And the first obstacle was the difference in quality and availability of the centers. And I remember there was this one center, beautiful, close to transportation. They teach your child French and Mandarin, just beautiful. Very, small class sizes and just fantastic. They don't accept vouchers. So then I went to a place, this was the same day, that did accept vouchers, and it was just so different. Just the aesthetics of the place, the ratio, I believe, was a little bit higher. And I just felt, wow, like the inequality starts so early on. I was just like imagining, if I could afford to take him to that first place, look how different his life is going to be already. I already felt it. So anyway, even though the center wasn't the best quality, I still was willing to take it. But first, there's a deposit that you have to pay, $200, and vouchers don't cover that. So if you have a voucher, that means you're getting cash assistance. That means you're not getting, certainly not enough to afford a $200 deposit just to get on the wait list. So there was that. So I was waitlisted, and the pandemic hit. Time went by. The pandemic happened. During the pandemic, my son was then diagnosed with being on the spectrum. So he was a part of early intervention. So I'm just going to fast forward a little bit to 2000 by 2021, after the pandemic, I was able to find a job at Macy's, minimum wage Macy's, in 2021. I finally got the paperwork in. They signed it off. They accepted it. I started working at Macy's, with the voucher, with the childcare. HRA then sent me a letter about 2 weeks after that saying that I was overqualified now. I'm not meeting the standards, so therefore my food stamps was getting taken away and my child care voucher was getting taken away. So literally it was just like, I felt so defeated. Like, what was all of that for, right? So at that point, I stopped work. It was a seasonal position. So I ended the position and I could not go back to work. And another obstacle, just to add on to what's needed, I feel, especially now that there are a lot more children that are being diagnosed with autism, there were a lot of childcare centers that weren't able to accommodate his disability. Paras, for example, they're only provided during 3K, 4K, and but not childcare. So that was another obstacle for me. So anyway, I ended up not going back to work, and my employer and we tried to come up with all these different ways, but it just wasn't feasible for me to go back to work. And so by 2022, I ended up going into a homeless shelter with Leo, who was at that point, he was 4 years old. We went into the shelter, we stayed there for a year. And finally, I was able to get an apartment this January with childcare subsidies. And Leo is now in kindergarten. So I never did get that childcare after leaving the workforce. So that's my journey with that. And those are some of the obstacles that I.
Was there, when you got the letter about getting kicked out of the programs a couple of weeks after you started at Macy's, was there any warning of that or discussion?
Not at all. It was the letter that they sent, and they said, by this date, you're going to be, because they saw it as a non-compliance. I remember the tone of the letter too. It was due to non-compliance. And so in order to get back into it, I would have to reapply, which was another obstacle. And that's when I really felt, when I was a case manager, I used to have clients and they used to say, oh, the system is rigged, the system is rigged. And I used to think, oh, they're just being negative and, they're not being self-sufficient. But I really realized, I said, okay, now I know how they feel. The system is rigged. That's exactly how I felt. Like it was just a game.
Mm-hmm. And so it seems like the system was designed to kind of prevent you from becoming self-sufficient.
Yes. It doesn't give you the incentive to go back to work. They signed off on it when I gave them the paperwork. Why wasn't it caught there? And so that was the other piece that was missing, is unclear income limits. Everything is just unclear and vague. It's not in writing. It's just they wait till you make the mistake and then they penalize you for it.
Yeah, well, thanks so much for sharing your story. I want to jump down to Lara. And I hoped you could give us a big picture overview of the report, including what its impetus was, any challenges that you encountered in gathering the data, and the biggest next steps that you think it points to.
Okay, yeah, that's multi-step answers there. Yeah, so I'll start with sort of how this came about. In the beginning of 2023, those of us in the coalition, many of our close coalition partners, folks who are on this panel, we were meeting for several months trying to sort of think through what is our next phase of Raising New York? Where do we want to go with our agenda? And after talking with all of us about parent needs, system needs, how can we best continue to amplify the systemic issues that we're seeing from parent perspectives, we decided that doing this, what we've been calling a process map report, which is very exciting in policy lingo, but was born. And the intent of this report is really to amplify and highlight the barriers from the perspective of the consumers of the systems, which are the parents themselves. And as I mentioned earlier, we know that parents and families, they know what's best for their families. They know best how interacting with different systems either support or hinder their ability to meet those needs. And so this has really been a great opportunity to hear directly from those who are using these systems. Your next question, challenges. So, we know that high quality data is such an important part of our work. We know for all of us in policy, especially, it's really essential that we understand how systems are operating, how systemic inequities are embedded into our system so that we can be informed when we make recommendations to change it. And for those of us in the early childhood world, we know that getting high quality data that gives us a complete picture of a child's life or a family's life is incredibly hard. And so that, I think that challenging piece, continued even with our partners on this report. So, and I can give an example. We had some programs who, as part of the parents that they work with, they do not ask families for their documentation status for very valid concerns about immigration. And because of that, there were limitations on how much we could understand, does a family's documentation status impact their decision to accept or decline a program or a referral? I think that just really drives home the importance of working with community-based organizations and advocacy organizations that have such trusted relationships with their communities, especially communities that are vulnerable, especially when issues like, for example, immigration are very much at the forefront of families' minds. And so I think that, while we've been able to collaborate with all of our partners to sort of help develop a more complete picture of a child's life, of a family's life, of what it's like when they go through different systems, it's really essential that we keep connecting and aligning with our partners so that we can really put together a more robust understanding of how systems are impacting families. Because until we have a really true, closer understanding of the complete picture, we won't be able to create long-lasting, sustainable change.
Thank you, Lara. Liz, you bring a background as a pediatrician and obviously take a very expansive and supportive view of that role. For those who might not be familiar, can you start by giving a brief overview of the Help Me Grow model?
Sure. Can you guys hear me? Yeah. So Help Me Grow is a national model. There's about 130 different Help Me Grows across New York, across the nation in about 30 different states. New York actually currently has 5 Help Me Grow systems. Long Island is one of them. There's a system in Western New York, Finger Lakes, Onondaga, and Oswego. And we have about 4 other communities across New York State that are actively pursuing starting this model. And one of the things that I love to say about Help Me Grow is that it is not a program. It is a systems model. So at the community level, and each community gets to define what that is. For Long Island, it's both counties of Suffolk and Nassau. We went to the community and everyone decided to choose that as the whole island because parents and families don't identify themselves as being from Nassau County or Suffolk. If you've ever met anyone from Long Island and you ask them, where are you from? They say Long Island. And then they either say their school district or their like unincorporated village, right? Like that's what they say. So that's why we're Help Me Grow Long Island. They told us that. When we went upstate to Oswego and Onondaga, 2 counties right next to each other, they were like, Onondaga is its own place. It's got Syracuse in the middle. Oswego's very rural. It's got its own place. We're going to have 2 separate Help Me Grows because that's how our families live. And so it really comes down to the community defining and then the community coming together to really understand these problems. And the systems building part of Help Me Grow is data collection. So for families on Long Island that are concerned about their child's development or have a concern about how they're, anything to do with raising their child, they can call us. They can get referred to us from a number of different places. About 40% of our families at Help Me Grow Long Island come to us from pediatricians. And so these are pediatricians, which is a near universal contact point for young children. I don't know how many of you have young children in this room, but by the time your kid is 5, you are really tired of going to the pediatrician's office, right? Because you've got all those well visits and then you've got all those sick visits and it does. And a lot of people want to make that pediatric visit the place where everything gets done. But I'm telling you, I don't practice anymore, but when I talk to practicing pediatricians in the 15 minutes they have to see that child, there's only so much they can get done in the 15 minutes. So what we're really about in Help Me Grow Long Island is breaking down, making sure that stuff happens outside the healthcare walls. And so you're bringing back to the community and we're bridging resources so that we're serving families more effectively and efficiently. And as we help these families on Long Island, 97% of which are on Medicaid, 81% of which are children of color, and 70% of them speaking a language other than English at home. Doesn't really look like what you think about Long Island, but I'm telling you it's there. When we help these families, we collect a lot of data, and using that small sample size can then infer and figure out policy changes that can make a difference for kids' lives. So I think, does that explain Help Me Grow a little bit? All right, great.
Thank you. And one follow-up for the report, Help Me Grow focused in on a very specific need, diapers. In what ways is the persistence and prevalence of diaper need illustrative of some of the bigger gaps and issues with programs like SNAP and WIC, and really kind of meeting families where they are through those programs?
Yeah, I think it's a great question. I see diapers really as a canary in the coal mine, to use an old description. And so if you're there with a 13, 14-month-old and you don't have any money in your pocket and you're down to your last bag of diapers, box bag, I don't know, however you're purchasing them, and you don't know where that next diaper is coming from, that's a crisis. That's a crisis for how you interact with that child today. That's a crisis in brain development for that child. Because let me just tell you, you are not doing serve and return with that kid that day. Right? You are completely stressed. So we really see diaper need as a canary in the coal mine. So when parents call us looking for diapers, looking for an emergency set of diapers, which we do give, like on an emergency, I'm desperate, I need a box, we will get you a box. Please don't put that on the news tonight, because the people who work for me tomorrow will scream if they get 1,000 phone calls for diapers tomorrow. But we do that. Most families can wait a couple days, so we're able to work with our community partners. Help Me Grow Long Island doesn't hand these out, but we know of every place in Long Island that will hand diapers out to families in need. We link that to where the community is, and we link that to their service. At that same time, we say, are you on SNAP? Are you on WIC? Because money is fungible, right? If you're still on WIC and if you're on SNAP, you're getting your food subsidized and therefore hopefully have extra money to pay on diapers. Sometimes it's just basic financial planning that we're helping families with, because it's really hard to do that when you're stressed. In addition, we know that child's development is at risk. So every family that calls us for diapers, we're encouraging them to fill out an ages and stages social and emotional questionnaire. And these questionnaires are helping us track those children's development, knowing that they're at high risk for developmental delays because they are living in toxic stress. And that's how we kind of see this whole process as working together. If there are concerns with that child's development, we will help them get early intervention, which is another issue I don't think we're going to tap on today. But we'll help them get early intervention. If they're monitoring, we will help them monitor and promote child development. If they're fine on the developmental, we will celebrate, because that means that family has incredible resilience in spite of having huge challenges. So we take the moment to celebrate how wonderful they're doing with their child, because their child's development is on track.
Thank you. Liza, could you start by telling us some of the background on the Alugu Dia project and what you learned?
Absolutely. And I want to take a quick moment to call out the two people in the room right now that actually were like the real architects of this project, Tiffany Arvis and Monica Seabree there. If you guys could like raise your hands up for a minute. So this project actually started because Monica called me up in spring and she said, I have been seeing parents with children all over the subways, young kids with their parents selling candy, selling fruit on the subway. What can we do something? What can we do? And we said, well, we're not busy. Sure. Why not? Not a lot of other things going on. And we literally pulled this project together from scratch. And functionally, the idea is we know from this project that the parents who are in these positions selling fruit or candy on the subways, in parks, in public spaces, that these parents are not getting reached by anybody. So we surveyed about 75 of those families, and this was bilingual social workers. So no one in a uniform, no cops. The idea is you need to send someone trusted who speaks the language to find out what's going on. What we found, unfortunately, but not surprisingly, is that about 93% of the families we spoke to were not connected to any agency or organization. None of them. Almost none of them. And about I would say about 64% or so were not living in a shelter. So even if they were a part of this sort of asylum seeker situation that we've been seeing, we were not actually getting them connected to anything. And so what happened was we really pulled together a project to say, let's go to where they are, right? Let's go find the parents where they are on the subways, in the parks, and see what they need. Just ask them, what is it that you need? Is it connections to childcare? Is it connections to support? Is it connections to healthcare? Anything that they needed was really like the idea behind this, to say, like, you got to tell us what you need. And so we were finding out they weren't connected to anything. They were not getting any of these resources, even the ones they were eligible for. So they weren't even in the position that Amy was in, where they're struggling with the existing system. They're not even in the system. They're completely falling through the cracks. And as that project developed, we were able to actually expand to having some more social workers out there, to having families actually be spoken to and be asked. 46% of those parents that we spoke to were like, if I had childcare, I wouldn't be here, right? I wouldn't have to do this, but I have nowhere to bring my child. I am not in a shelter. Oftentimes they're not work authorized. So it's not a question of, do you want to get a job? It's they're not allowed to, right? If they filed for asylum, they got 180 days that they have to wait, right, to even get work authorized, or if they're not part of a temporary protective status country of origin. And so we have these parents in a position where they don't have any options. They didn't have a solution available to them at all, which really helped us actually to strengthen the argument around the Promise New York City child care program that we so thankfully won an additional $9 million for on the city level this year, because that is the only real existing program that provides child care vouchers to children regardless of citizenship status, which is something that our ACS vouchers and a lot of our other positions, they don't do. And if you're in a 3K or a pre-K program, even if it is publicly funded, those are 6 hours and 20 minutes a day. Most people are not getting out of work at 2, 3 o'clock in the afternoon. They need a full day of care. And so really figuring out where those pressure points are, how do we tell parents' stories? And how do we tell the stories particularly of the parents who are in such a position that no one is finding them, that no one is reaching out to them? And how do we make sure that they're actually getting access to more of that information, to more of those resources, and so that we better understand who these parents even are, right? Why are they coming here? Are they coming here for safety reasons? Were they coming here for better opportunities for their children? Many of them are coming here without other options, right? They came here because they had nowhere else to go. And now they're on the subways with their children because their children have nowhere else to go. And this is a project that we really, really love, that we want to expand more, particularly because no one else is doing this work. I mean, no one is just going out there and finding these kids and parents and actually just talking to them and figuring out what they need and providing them those resources.
Thank you. Just what did that work and Liz, you might want to weigh in on this also. Point to in terms of what are some of the steps and solutions that we need to take to better reach families whose first language is not English, that go beyond translating flyers.
Yeah, absolutely. I mean, number one, bilingual social workers, right? We want people going out there who not only speak the language, but who actually know how to talk to families in a way that isn't terrifying to them, right? You can't send a police officer with a flyer to talk to a parent who knows that they really aren't supposed to be on the subway with their kids selling candy. They're going to run in the other direction faster than you can blink, right? Whereas if you send a social worker and you send someone who's like culturally aligned with the parents you're speaking to, they're immediately going to have a stronger sense of trust. You can be certain that that family is going to be respected, right? And that their needs are going to be recognized and reflected, and that you're going to get honest answers from them. We don't push, right? If a parent doesn't want to answer a question, you don't ask that question to that parent, because that's not the point of you being there. The point of you being there is to make sure that you actually, get the information that they need to help them. And so we're really looking at the bilingual social workers as the peak way to do this. But then there's also obviously resources. You need to translate everything, right? Translate into the languages that people are actually speaking. The primary population that we spoke to in that first wave of the survey were, I think, 75% Ecuadorian. Right. So a lot of times you do see those kinds of trends, and you can identify what languages you need based on the populations that you're seeing. Those trends shift over time, but they don't usually shift so rapidly that you can't keep up with it. So language access is a huge part of that. And then I think the third piece is knowing where to refer people, right? Knowing which of the community-based organizations and the people doing the work across the city have the resources, the information to be able to help people and to find them, where they are. A big part of what Alhundias and what Tiffany does every day that she's working on this project is literally calling up childcare centers. Do you have space for this parent that we spoke to? Do you have the linguistic capabilities to support that parent? Are they geographically close? We've talked about childcare deserts. Are there even available childcare providers in an area? And can you make sure that you're getting that resource to them and helping them with the process? It's such a complicated piece to navigate. Again, Amy spoke to even how complicated it was to work within the existing system. When you add documentation and immigration status into the equation, the complications are exponentially larger. And they were never easy to begin with, clearly. So really making sure that people get that information in trusted ways through trusted networks is a way that we can not only support the parents we're speaking to, but the childcare providers themselves who can take things like Promise New York City vouchers, who need kids in seats that they can support during the course of business. So we're really looking at all of those pieces as ways to do it. But I think ultimately, New York City is so big and has so many people that navigating those systems is like a PhD level requirement. People are trying to figure out childcare when they're still in the womb. And even then it doesn't always work. And so I think what we're really looking at here is how do we create a system that is inclusive of immigrant parents, no matter what their sort of situation, immigration status, economically, et cetera, but also that we're using the systems we have to bolster the other systems we know we need, right? So I think all of it is kind of, we talked about holistic, right? That's the holistic part of it, I think, for me. And I'll pass it to Liz.
I actually have a anecdote. So when I was seeing patients at a federally qualified community health center, this is a long time ago because I remember my own kids were young and they're both now in college. I had a patient who was actually Ecuadorian and I was very close with her, and she wanted to apply for childcare. And I had always been interested in childcare and sort of this intersection. And so I said, okay, let's fill out the application together. And I think it was, I don't know where you had to actually take the application at the time. It might have been down on Worth Street. So she had to take the morning off from work to go down to submit the application. I had filled out the application. I filled it out. It was filled out incorrectly. She brought it back to me at the clinic the next day. I tried to fix what they told her was wrong with the application. She went down the next day. Now I'm getting mad. Came back. It was a different person that saw her the next day, and it was still filled out incorrectly. And I think it was at that time, it wasn't soon after that, that I met Jen O'Connor in the back, who's now still a dear colleague in Raising New York, and really realizing it's the system, not the parents. And that is just a mantra. And I think one of the things that's in the report is it's not availability, but accessibility. And that accessibility has to be from the viewpoint of the parent, not the viewpoint of the system. And in order to do that, we actually have to ask the parent what the experience was like, right? If this was a business, right, you'd actually understand what the consumer's experience was. And there isn't a lot of consumer respect built into any of these systems. And that's what we're really working to do here. And I will say on Help Me Grow Long Island, we have a list of 400 different community-based organizations that help families. Sometimes they help all kinds of families. Sometimes they specialize in young families. And we have a section at the bottom where we keep our notes. And our notes have nice things like, don't send this kind of family there. It says, They sometimes have diapers, but the people are mean behind the desk, right? Like, you know, very nitty gritty stuff, which if you don't, getting back to the data, if you don't have the data at that community level, at that microcosm level, it's very difficult to start to have change. We published a report back in 2022 showing how on Long Island, with its 125 different school districts, there was a huge delay in getting families evaluated for preschool special education because they were required to show that they lived in their community before they requested. We were able to work with over a dozen school districts to help improve that process, but it's still a barrier today, so that we have families that are requested to bring in proof of residency, which includes a letter from your landlord. And if you are living in a untraditional housing situation, let's call it, unique housing situation, you can't get that letter from your landlord. And so it's very much understanding what's going on at the microscopic level, and then being able to step back and make those policy recommendations, make the changes. And I'll tell you, when we talked to superintendents, the superintendents wanted to know about those kids. They wanted to get them evaluated and get a child with potential autism spectrum disorder. They wanted to get that kid services at 3 so that when they walked into the school door at 5, it would be okay. The biggest barrier was often the person sitting behind the desk and who didn't really understand the connection between getting this kid services and having them ready for school at the age of 5. So I could go on forever, but I think that is, and it goes for the translation service as well. I will say one thing about the translation services is that bilingual service providers are the best case scenario. However, right now, still to this day, many counties and many places in the state are having hiring problems, and it's even harder to hire someone who speaks 2 languages than it is to speak 1 language. That being said, with technology today, there are many, many ways around this, especially given the diversity of languages and places people all over New York City come from. And we are not embracing those technologies enough. If you are at Bellevue's hospital, you have no problem getting a simultaneous translator on a screen into every patient room that you're going into. That is not happening in our social services, and it needs to start happening. Sorry.
Yeah, I just want to add that parents feel alone. They don't feel heard. They don't know where to turn to. So one of the systems you should use that's holistic is use the natural relationship that is between provider, the child caregiver, and the parent. There's the first person they see when they drop off their child. They trust. There's a trust established, and that is what we're hearing. Parents are not trusting the system. There is no trust. We, again, one of our co-founders had to accompany a parent all the way to Queens to get to talk to a caseworker, because when the parent went to the HRA, the Human Resource Administration, that's the DSS office, she was receiving the cash and she wanted childcare. Because they didn't understand her, and yes, language was an issue, they called the police to escort her. She was crying, and her provider was one of our members who came to us. So Doris went to she said, "You're going to get seen today." She went to the Queen's office and she got childcare that day. It took a human element. The parents are human beings and they're alone. EC on the Move is successful right now because the providers realize that they're not alone. Again, I was a provider for 16 years. I felt alone. I didn't know that I thought there was something wrong with my model. I loved what I did. 16 children, I always maxed out, always offered night care, did everything. You walked into romper room when you went into my program. What was wrong? Why couldn't I afford to give the quality that I and the parents wanted together? Why couldn't we make that happen? Why couldn't my money plus parent money come together to give the children? My goal was to take the children outside of the Bronx and into other areas of New York City to experience what other children are experiencing, and that the learning shouldn't be inequitable. But after year 1, those children got to see everything. They went to places unheard I didn't know existed, and we enjoyed ourselves. I was broke. Parents was broke after that. Year 2, we said, let's pare it down. They got to see less. Year 3, we went to the park. That is unfair. That you are creating barrier, you're limiting opportunities to children just because of where they live. So I became the poor serving the poor. And then you have, parents knocking on the door, speaking to what Liza's talking about. Parents don't speak English. I don't speak very well Spanish. And they come with the family and they need childcare. They come to us first. They see the sign on the window and we're in the neighborhood. They want childcare, but then to find out their status is preventing them from obtaining childcare. And I feel bad because I know they hear the children laughing behind my door and enjoying themselves and learning and having fun and leaving and going to the park holding hands and laughing, all that. And they come to the door and the status, and what happens is, and what happened for me for 16 years is offering care below the rate, below even the market rate. And that is not, you're not supposed to do that. And I'm just told it myself. But who can tell the parent and the child, the 2 or 3-year-old, that they cannot come in and learn with their peers in the inside? I could not participate in that. And we will not participate in that. We will not turn down the children in our community because we're underfunded. We have to find a way. So if we can find a way as providers to work with the families, you have to help us. You have to make childcare. You have to, and the last thing I'm going to say, please. We're hearing providers saying, well, we must up our rate. We didn't get the investment we were looking for. We have to up our rate. What do you think that means? That means upping rates means that families are not going to be able to afford. This is a vicious, endless cycle that must be cut, or you will lose your families in New York. They will leave. New York must start the way. Yeah.
Thank you, Shanita. I liked the framing that someone had mentioned earlier of consumer respect. And in what all of you have said in the last few minutes, there's been some examples embedded of ways that we could show more consumer respect. But I wondered if each of you could think for a moment about one specific way that these systems could and should improve to be better in the consumer respect area. And happy to start with whoever feels comfortable diving in.
I'm just thinking about HRA, which is the human. Oh, it went off. Okay. Hello. I'm just thinking of HRA, which is the Human Resources Administration, and that's basically the offices that she mentioned, the story that she was sharing, that you go to when you need cash assistance, food stamps, and child care subsidy. So just think of like the DMV, right? Like everyone usually jokes, and everyone knows how it is when you go to the DMV and it's just awful, right? But at least the DMV, okay, you have a car, so you're probably doing okay. So your dignity is still intact after that interaction. But just my personal experience, people who are going to the HRA, you feel the lowest of the low already. You're confused about what to do, and you're feeling really down, and you go in and they're so mean. The workers are so mean, and I think the report mentioned poor, unreliable communication, basically. And so I think for me, one thing, and I understand, I'm sure there's like high turnover rate and all that. I get all that, I understand. But definitely like the trauma informed just training on just how to treat people. It shouldn't be acceptable. It shouldn't be okay that that workers are allowed to. Sometimes they're screaming, sometimes they're yelling. They'll call the cops if they don't understand. They just need to be more compassionate when working with the people that are coming. I mean, these are the neediest of the needy that are coming in for help, already feeling less than a human. And then they get treated this way by, these employees, and the employees are representatives of the government. The government is very scary to people, right? Like the government, and this is how they're treating me. So I hope that answered the question. I just think more trauma-informed, better training of the staff, on just how to treat people. Just, yeah, common dignity and respect.
Yeah. Do you mind? I was just gonna, you stole trauma informed right out of my mouth. And one of the tenets of that is not what's wrong with you, but what happened to you, right? So really shifting the interaction to change to that voice. The other thing that I will mention is that many of these places are not accustomed to dealing with very young children. So in addition to trauma-informed practices across all staff, I would argue that people don't come from big families anymore, and they might not have ever seen a 6-month-old before and not realize what normal behavior for a 6-month-old is, what an 18-month-old normal behavior, what a 24-month-old normal behavior is. And it's not sitting there quietly at all, right? And so if you are having young children and parents with young children accessing these services, we need to have an environment and people who are familiar with that. I remember during the pandemic when we were sending families to food banks, a lot of our moms didn't go because who's in line at a food bank? Single elderly adults. And they would get treated like crap in line with these other people. And they would have an express line for those that are like at risk for COVID. That, never mind, that's my cheap glasses. That might have been over 65, might have been able to go like an hour early or whatever. There were no accommodations for families with very young children. And we all know, anyone, it's much different bringing your 6-year-old to an appointment with you versus bringing your 6-month-old or your 16-month-old to an appointment with you. And so in addition to trauma-informed, I would say age appropriate.
I'm going to yes and. I fully agree with both of those. I'll bring it to the immigrant perspective a little bit too. And I'll bring it back to Promise New York City, which I think actually has done a phenomenal job of respecting the way that parents actually come into the systems, right? So one, ACS was very, very aware of their own reputation, particularly with families of color, and said, we're not even going to put our name on this. Everything about this program is going to go through community-based organizations who are actually trained to make families feel comfortable, and so that they do not, their information will never go to ACS. They are not going to get a name. They're going to get aggregate data only. Another piece of that is that they don't actually ask your documentation status. The way that they ask the question is, are you not eligible for other forms of childcare supports? What that does is it gives parents a way to not have to say, I'm undocumented. When you ask people questions directly like that, then they're going to be like, well, I don't know. Is my information going to go somewhere? They might present that to you if they, give it in a trusted manner, but that's the way that they've like implemented it across all of the organizations that run this program. Are you not eligible for other forms of childcare? Here are the eligibility standards for the other forms of childcare. You don't have to tell us what makes you ineligible. You can just say that you are. The other thing is, unlike the other systems, especially, the federal money voucher systems that kind of trickle down, they do not require, for example, that your boss sign something saying that you're employed. Many of our parents who are eligible for this program are also undocumented or also don't have status. They are not going to be able to get their boss to confirm that they've been hired, under the table. So the program actually allows for parents to sign affidavits instead, saying, no, I'm just confirming for you, this is how much money I make. And that I'm otherwise eligible for the program. Trust parents is, I think, the point here. Let parents tell you the truth. Let them access the resources they need, and don't put them in positions that make them feel not only uncomfortable, but potentially even in danger of something like deportation, right? So I think even thinking about the ways that we ask the questions about eligibility are things that we can be more thoughtful about, and we can really create systems and dialogue with parents that supports them, that, you know, really understands things like that they have been traumatized and not, you know, necessarily having anything to do with their own behavior, and really respecting what their current status is and understanding what those implications are. You don't have to be an immigration attorney to know, you know, that an undocumented family is going to be terrified of ICE coming to get them. And any way that you can make them feel safer by simply changing the way that you ask questions and the way that you tell them is going to be a major game changer, I think, for those kinds of families.
Yes, I'm also going to yes and every single thing that's been said. And just want to also add, in our report, so in every community across the state, we had New York City, Long Island, Rochester, the Adirondacks in the northern part of the state. Every location, families kept saying, we want a human connection. We want to be able to talk to a person to help us explain and understand what we're eligible for, and definitely to the trauma-informed, respectful, culturally responsive and appropriate interactions. But we heard just time and time again, we want to talk to an actual human. And I think that really just is another really important reminder that this is about relationships. It's about trust. This is, as Amy was saying, it can be, you know, incredibly, there's so many feelings when you're going to an office where you might have to ask for, you know, an application for benefits or something that is bringing up all sorts of feelings, and it's about trust. People want that connection to feel support.
Yeah, I'm going to say that. Yes. We need better policies and budget, better everything that care about people, care about parents, care about providers, care about relationships, everything that's been set up here, because I will walk you through what it really looks like. Okay, what it really looks like is a parent got an interview to go to work, got a start date, needs childcare immediately. Why are we not valuing her time, his time, their time? Why are we not valuing someone who's trying to make it in this world and have small children? So the policies, when you have poor policy like that, poor communication, poor policies that don't value families, this is a reflection from the top. We don't have access to the top. The top down, whatever the top wants is what will follow all the way down to the parent, and a provider will receive. None of this is happening right now. Parent goes, applies for childcare, comes out with the form. There's new initiatives now. Yeah. The initiatives have to continue to improve. You don't just create a initiative and we're done here, folks. The parent gets the voucher, takes it to the provider. This is 6 weeks. Should she forget something, it's another 6 weeks. So what happened to the job? So EC on the Move has to consistently create, I'm consistently recreating our grievance form. We had to create this out of nothing. Why don't you have your own grievance system? Where is the system that allows you to hear what's on parents' minds? Okay, so customer service is, yes, it's customer service. You get better customer service paying your bills. Where's the customer service? Where's the, is everything okay, Miss Amy? How are the kids? That is needed. We're talking about families. This is serious. 6 to 12 weeks is unacceptable. Right now, I have one case of a parent, and Larry, you probably have you saw that. She's still looking for care. She started with the HRA, so that tells us already she has cash. I don't know how they ended up pushing her case to the DOE, pushing it back to the HCS. We're in front of it, talking to the biggest offices we can. Right now, you know what she's doing? She's paying. So if she's paying and she's receiving cash, and I don't mean to scream, guys, this is just frustrating, right? So if she's paying, you know that the provider is not receiving hardly anything close to the cost of care. If she's paying, and she's just frustrated, and she just took care whoever will take the dollar she has. This is unacceptable. It's unacceptable, and it's rampant. I'm just painting the picture so you understand this is not one story, and I'm so sorry, and we can talk. But this story is just going on and on. Lots of people are experiencing this.
Can I just chime in? Here you go, Liz.
Okay. Just, I know we've focused a lot on the individual family story, and that's real, right? Like we can feel that in this room. But there's an economic story of what we are missing out of as a city and as a state. So for every family that doesn't get SNAP benefits, who is not enrolled in WIC, that means that local dollars are not being spent at perhaps the bodega that takes the WIC or the Stop and Shop that takes the WIC. For every mom that drops out of the workforce and isn't in the workforce, I don't know whether you had a pension at your old ones or your 401k, her lifetime retirement savings have been negatively impacted by the failure of our systems to work, which will be an issue. I don't know, I'm going to go with my age. So like 20 years from now. So this is not, it's at the family, but it's also at the wider macro system, and that our inefficiencies in our government systems are actually leading to missed opportunities for our economic growth as a state and within our communities. Because that childcare provider that's been waiting 12 weeks for this family is also not making money and not reinvesting in their community, and they're going out of business. So it is a vicious cycle, but I think it's so multi-layered that sometimes we have a problem telling this story, but it's impacting everybody from the business owner to the mom with the young kid under tow, right? And being able, and I think this report starts to tell that story, and certainly this meeting starts to tell that story, how it is a system issue, not just a family issue. Sorry, I stole that.
Can I respond to Liz?
Yeah.
Liz and others, there's a report by Dr. Stephen Parasa, forget which school. For every dollar spent in childcare, there's 7 more to earn. So we're talking about political will. This is it's math. Do the math. Who wouldn't want those extra $7 back in the state for every dollar you put someone to work who enjoys working and proud of herself and her family? And the state could earn so much money. So we want to keep those dollars down. Al, is that the message we want? Sorry.
Yeah, no, so many important points. And Shanita, I really liked your point about valuing of time and just how we're expecting people who have the least amount of time to spend the most time to get just their most basic of needs met. Since we have a couple of minutes just before opening it up to your questions, I just wanted to throw it out there to see if there were comments on early intervention. It's an area of my current focus in reporting, and it's frankly an area where New York just rates very low right now in terms of accessibility for families. And there are deserts like there are with childcare. But there are also places where there are providers, but families just can't get off of wait lists. And so I'd love to hear thoughts on what the biggest gaps in an area of need are when it comes to strengthening early intervention access.
It is definitely a passion of mine, and my eye is roaming to Randy from Advocates for Children, who've been working on this issue for so long. Early intervention was not always like this in New York State. New York State was seen as one of the leaders across the nation in early intervention. People used to move to New York to enroll their children in our early intervention system. And so we have fallen fast. We are now 50th in timeliness for services once a child's approved for IFSP. And from our work in Long Island, we do know that the children, not surprisingly, who are least likely to make it to IFSP and then receive services in a timely manner are children for poor zip codes, children of color, and children who speak a language other than English at home. And so again, our most vulnerable, when you have a system in crisis, the most vulnerable children are even more likely to be left behind. And so it really marks, since 2008, there has been an ongoing lack of investment in early intervention, and we are now paying the price. There needs to be investment and perhaps an overhaul of the system. I mean, it is just so bad right now. I don't think money alone is going to fix it.
Yeah, I'm gonna add something to that, which is one, obviously, again, this is a situation where language compounds the problem substantially, because there are often times when children are misidentified, right? They think they have a special need when in actuality they just don't speak English, and so they don't think that they're where they're supposed to be. Or the alternative, they assume that a child is not having any special needs when in actuality they're just they just also don't speak English, right? And so even finding somebody who can make that assessment is incredibly difficult. I think there is, to talking about like a sort of negative spiraling, there's also the reality that, children with special needs have the Carter case scenario, where if they're not getting it from the public education system, then we're going to pay for them to go to a private school. But what that does is siphon tons of money out of the public system. So every child that goes to, an expensive New York City private school, all that money is getting pulled from the resources that we have to do early intervention, to provide supports for those families within the system. So we're not just not investing in it, we're actually pulling more and more money out of that system, when really we need to make that whole system better so that every kid who comes in with, additional needs gets not just the identification of those needs, but also the placement and the support they need within the school system, so that we're not sort of pulling pieces out all over the place. And we can actually create a system that is long-term sustainable and also provides kids with what they need.
Just to clarify, so early intervention for kids 0 to 3, it would not be center-based. There's very few center-based, so they would all be actually provided in their home, which again, for children most at risk is also an issue. New York used to be more generous in providing center-based services for very young children under the age of 3. It's not done much anymore. Again, an uninvestment since about 2008.
Great, thank you. I'm going to open it up to questions from all of you now. I think, is there a roving mic or?
All right, questions. We'll try to provide answers. Okay.
Hi, my name is Jennifer Nahosa from the CSS. I'm a policy analyst. Okay. So when we did a study related to Bronx New Yorkers, right, trying to see like what was happening, the economic sort of landscape, the demographics as well, housing. Just to get to the point, we did some interviews at the POTS, called Part of the Solution, which is a nonprofit in the Bronx. And what I kept hearing was that there were mothers that were trying to go through training programs, but at the same time trying to apply for vouchers for childcare, and they were unable to do so. And I'm just wondering, I was like, oh, this is a research question, yet a policy, sort of like, what can we do? Because I think someone had mentioned that you have to wait 6 to 12 weeks, I believe, to get something, right? And then what we also kept hearing was that their family members that would live in their same household would also be out of the labor market, right? So that they could take care of the grandchildren. So it's more of like, maybe like a observation, less than of a question, but I'm just trying to think of like, what would be some of like the policy sort of like interventions, right? Because not only are we seeing the mothers being out of the workforce, but also their parents who are probably
need for childcare, high quality immediately. We would invest in more folks working at the departments, high, up-to-date technology systems so that you're able to process applications quickly. Like, it's about where are we putting our money to ensure that things are either coming out quickly, that they're effective, that they're accurate, or are we relying on systems and, underfunded workforces to sort of get these through. So I think that is definitely, a really great example of it's about what we're valuing as a society. And the more money that we put into the infrastructure, that's how we solve these problems, able to get things done more quickly.
I know we have another question, but just 1 second. How we put that money in also matters. We have seen an unprecedented investment in childcare in New York State over the past 3 years. I don't want that to go unmentioned. However, it has come through in sort of one-off grants, in you apply for this, you do this, a big chunk of money dumped on New York City, and then New York City having to figure out how to get that money out the door. What hadn't come with that big chunk of money is implementation funding to actually hire the extra staff and the knowledge that you're going. I mean, I run a small business. My nonprofit's a small business. I don't want to hire someone if I don't know I'm going to be able to keep them on after 6 months, right? And if I do have to hire them for 6 months, the quality of that hire is going to be less so than if I know it's a permanent position. So I think it is sort of a systems level, and it matters how we invest this money in addition to the amount, so that it's not just dropped bunches of money and then scramble to figure out what to do with it. Again, not complaining about the money that's come into the system, please more, and infrastructure.
I'll add one more piece, because we're at Robin Hood, which is obviously really focused on poverty reduction, is that we're also we can also help parents directly, right? Like, I think that we know that parents know what they need, and doing things like looking at the budget more broadly and saying, we actually need a bigger child tax credit. We actually need for parents to just be getting more money to address all of the issues that they have. Maybe today it's diapers. Maybe tomorrow it's childcare, right? Maybe today it's that my car broke down. And I can't get to childcare, and I can't get to work. And that is going to put me into a cycle, is looking at this as a broader issue and saying our budget should reflect parent needs, not just in one place, not just childcare providers, not just the childcare system, but also the parents' ability to literally make ends meet day to day. And that's another way to, kind of look at the situation. We should push for this on a bunch of different levels.
So I was going to wait till the end, but because we've jumped into policy and I have the mic, I'm just going to I'm going to talk about our kind of call to action right now. There are 4 bills that are slowly making their way to the governor's desk. She needs to sign all 4 of them by the close of this year. 3 of them get to the heart of what Liz was talking about with childcare. So we have greatly increased funding and eligibility for childcare, but not access. And so one of the bills would decouple a parent's work hours from their subsidy. So right now, private pay parents put their child in a childcare program from 9 to 5. That's when they work. That's what they pay for. If they're a little late, they don't pay any extra. That's the agreement. They keep the kid. If you are on subsidy, you have to be at work. You can't be going to a doctor's appointment. You can't be going to a student teacher conference. You can't be working in the gig economy or some sort of non-traditional hours to get your subsidy. So that's bill number 1. Bill number 2 is a presumptive eligibility bill. That means that everyone is just presumed eligible for childcare. Your kid gets into childcare. If the county finds out a month down the road that you aren't actually eligible for childcare, the state picks up the cost. But you are immediately eligible for childcare. And the third is a minimum earnings bill. So there are people who actually don't make enough to qualify for the subsidy, which seems completely counterintuitive because it is. So those are the 3 childcare bills. The 4th bill is an early intervention bill, and again gets to what Liz was saying about kind of blowing up the system. It's a rate reform bill that the commissioner of the Department of Health has completely endorsed and is behind, but we're hearing the governor's office is not so crazy about it. What it would do is study the early intervention system and figure out why we spend so much money and people are not paid enough and kids are going without services. So if you weren't on our listserv because you attended this meeting today, you are now. So you're going to receive pretty soon an actual call to action. It may be a petition. It'll be something really quick and dirty that you can take action on. And we hope that you will do that, because what it's going to take to get these 4 bills signed is parent and family voice. So next question. Megan? Here.
Thank you all so much. This has been really thoughtful and informative, and I really appreciate it. I'm Megan McAllister with the Altman Foundation. There's obviously several buckets of things here we're talking about, right? Just an underfunded system, a not well coordinated system, all those things. But I was saying just about the accessibility for current benefits. I feel like, deja vu all over again, because when I got into philanthropy, I think 19 years ago or something, the first thing I funded was this app called Earned Benefits, this software, which integrated all of the qualifications for WIC, food stamps, EITC into one platform, and families filled it out once and they were told what they were eligible for. A bunch of things, as a group called Seedco created that. It was, I think, at the single stops for a while. Robinhood funded it as well. And then there were issues, as is often the case. But in any case, I just wondered if you're seeing, you talked about technology helping with language access, but if you're seeing any promising tools out there to at least solve some of the application problems.
I would say that during the pandemic, there were times where with the Human Resources Administration, where they did streamline some of the processes. They made it a little bit simpler, where you didn't have to actually go in and deal with, what I was talking about earlier, and do the applications online. So that was simpler. You do have to be kind of web savvy, but I think that actually was one positive that came out during the pandemic, that they did rely on, just the web-based. I think it's under the New York State website.
I didn't tell you here are all the HRA programs you qualify for.
Well, it was, I think from what I remember, it was, you would put in, they would ask you questions about your situation, and then based on that, you would say, okay, you qualify for WIC, you qualify for SNAP, you qualify. And then, but even if, like in my case, I was already in the system, so to recertify the online program, the web-based application, it worked. I think it was a little bit easier than having to deal with the environment. So I don't know if that answered your question, but
Benefits is generally a community-based organization for helping families use it, navigate it. I don't know.
So yes, and there are definitely some improvements. I know we rely heavily, and I think Jen O'Connor is going to have to help me with this. What does NOEAP stand for? From Hunger Solutions. So they, for SNAP, they have provided online, nutrition something. I'm terrible with acronyms. You'll have to forgive me. But, numerous community-based organizations throughout the state and New York City have extra people who will help you walk through food stamp applications over the phone, online, all that kind of stuff. And it really does help. We constantly on Long Island, it's actually in the report, we overwhelm them. And then we have to switch, like Catholic Charities. So we'll send it to Catholic Charities for a while, and then we'll switch over to the Health and Welfare Council. So it's never met the full need, because you can fill out the form, find out what you're responsible, what you're eligible for, but then you still have to go through the process of applying for WIC, applying for SNAP, which are all separate processes. And what's unique about that is many of these things are built for adults, and they're not built for families with young children. So in the health field, we have a lot of push toward social determinants of health and creating close the loop computer applications. There's a number of them that are for-profit and nonprofit. And our families have a hard time because it comes from the medical system. So everything's built on the individual and not the family. And so if you have a database or a system that's built on the individual, it really wreaks havoc when you've got a mom with 3 kids, because that's actually 4 things you're entering into the system in order to make it work correctly. So, and there is a great opportunity for those of you that are interested in this, in that there is I'm going to get the number wrong. I'm not only bad with acronyms, I'm obviously bad. So it's a 1115 waiver. Yeah. Okay. So the 1115 waiver, which was approved for New York State from the federal Medicaid and Medicare agency, is that we have a Medicaid waiver in order to create these social care networks across different communities across New York State to be working on this. There are coalitions now forming across, and it's going to come out of the medical system. And I think it got out that I'm a pediatrician, has its pluses and its minuses, right? When it comes out of that system. So there's a lot going on in that area, and it will be very interesting over the next 5 years to see what happens as these social care networks are created in each community. So that's, I think that's where this stuff is sort of now starting to live, is in that 1115 waiver. Did I make sense, Jen? Yes. Okay. She's more into the policy than I am, so I have to let her like fact check me.
Yeah, I'm just going to add one more thing, which is actually something that the NYIC does, which is train the trainers, right? So we've actually had trainings alongside other really valued partners for places like family welcome centers, where someone comes to enroll. But with immigrants in particular, benefits are tied to whether or not you're considered a qualified immigrant. And that is a very specific set of legal designations that many families don't know the answer themselves, right? Asylum seekers are a great example of this, because it doesn't say, like, you say, oh, are you an asylum seeker? Well, did you come to the border and say I'm an asylum seeker? Sure, that doesn't qualify you, right? What qualifies you is having had an adjudicated case around your asylum situation. So I think that one really, really valuable tool is finding places that train all of the people who actually sit with folks and do this work, so that to make sure that they really understand these distinctions, so that they understand what questions they even need to ask, but making sure that that information actually, there's a vector for that to get out into the broader scope of the work. Because a lot of times, even the folks who are at like ACS are like not 100% certain which, every individual status and what qualifies. And that's not like an easy thing to figure out. And so I think also making sure people really understand those distinctions and training the people that not just do the work, but training other people to go out and spread the message even further is a huge benefit, I think, to just getting access overall.
Hi, everyone. Milkar Guzman with the Pritzker Children's Initiative. We're based in Chicago, but do work all across the country and work in a number of different states. And in a number of our states, folks are also working on systems change and making things better for populations. But I'm wondering, but something they often face is folks who are completely missed by the system that they're creating, right? And Liza, you kind of talked and gave an example of that. And so I'm wondering if there are other examples of populations or groups that you all see that are totally missed, or in the future, right, things on the horizon here in New York State.
Yeah. The working poor, especially, the working poor on Long Island. It's a very expensive place to live. We do not have the long-term, long-standing 150-year-old social service providers that have existed forever. And it's a very suburban environment, which is sometimes very difficult to do this work in. So I would say the working poor, because they're not going to be eligible for many of these benefits, and they take a different approach, and they want a different interaction. They want to choose what they're going to access and what they're not going to access. And you have to really, just like a migrant, you get to meet them where they are and help them, empower them to make the decisions that are right for their family. I do want to just, along those same lines, earn the tax credit is a wonderful way of reaching so many different families. And when did we pass it under 4? When did we change it? 2 years ago was the first time New York State changed their earned income tax to include children under 4. Now, I'm sorry, that's backwards, right? They should have been the first ones to have it, because the families that are the poorest are families with children 0 to 3. We know that. And so they should be getting the largest tax credit. So anyways, so one population that's truly missed is the working poor.
So yeah, just to pull it out also statewide, right, is that we talk about one game in New York City where we do have an incredible amount of infrastructure. When we pan out, NYC is a statewide organization. When we start asking folks in more rural areas. What do you need? Transportation, right? Is like one of the biggest ones. I mean, and oftentimes this is the working poor. These are people who can't afford a car, right? And there isn't good transportation available. So even if you create systems that would accommodate them in terms of eligibility, they can't get there. They can't get to the childcare provider. And so looking at the pieces that are the connecting pieces is also really, really important to addressing the issue, because those are folks who, again, are not coming to a center because they have no way to get to that center to ask the questions. So if they don't have a phone or the internet, which is another huge gap that we've seen a lot in English language learner families, is that they have maybe their phone and maybe it's 5G and maybe it works and maybe it doesn't, right? And trying to navigate everything on your tiny little phone screen, trying to find a provider of something, trying to find information on something in your own language, that's like the barriers pile on. Right? It's like you're hopping over the short barrier and then there's a taller one and then there's a taller one and you've got to figure out how to jump all of those. And so just noting that, New York City, in all of the ways that we struggle, we are so lucky to have the incredible organizations and infrastructure that even does exist here. But pulling it out further, we have to make sure that, folks all across the state have the same sort of access.
Hi, everybody. Thank you for this. Dia Bryant, it's clear that we're not short on obstacles and barriers. But Jen sort of laid out the 4 bills that you're tracking for signature over the next couple of months. I'm wondering a lot about what you're thinking about as we come up on session. What are, some of the big rocks that you're thinking about for this session? Of course, investments, but also really significant things that need to happen in terms of state infrastructure. I sort of say that with the sort of background that the CPRAC, or the Child Poverty Reduction Advisory Council, mouthful, will be hopefully releasing some recommendations soon. And I'm just wondering what y'all are hoping to see there and what you're going to be acting on this session.
So, I mean, we've talked about tax credits a bunch. I'm going to talk about them a little more, right? Tax credits are one thing. Expansion of the child tax credit is one way we can get cash into the hands of parents, like in the most effective and efficient way possible. They're already filing their taxes. They have to do nothing extra on top of file their taxes to get that. And you're looking at potentially expansions to that in this coming session. And that's both a legislative fix and a budget one. We do that on the budget timeline, but it's actually a change in the legislation of the Empire State Child Credit, or potentially what we want is the Working Families Tax Credit. And so looking at that as one of the broader pieces of saying, how do we both fix systems and how do we both get cash into the hands of parents when they need it? That's definitely a big one that we've been looking at.
Yeah, thank you for the question. I think that's, part of why we timed this event right when we did, because with this report, with our partners, we are, planning to continue talking about this and making sure that this is at the top of elected officials' minds as we go into the budget session. In addition to the Child Poverty Reduction Council, is such a mouthful, working on recommendations. So is the Child Care Availability Task Force, which is another governor-appointed entity that is charged with submitting recommendations to the governor. And I think, again, connecting, aligning, Robin Hood, who is hosting us today, they are doing so much work around the issue of child poverty. And I think we really have some potential in these next few months to, continue to be aligned on all the ways in which we need to support economic security. And that means childcare, that means early intervention, that means the child tax credit, that means healthcare. That is all of these pieces. And I think, we know families are leaving New York. We know this is happening, and it's families with young children. It's families who are finding that they just cannot continue to live here. And so I think we have a real moment to really lean in on this. But I can't stress enough that we need to continue to work together, because if we're all saying messages that are like, there's power when you unite, there's power when you connected. We are all in this room because we understand the importance of supporting families from the start and all of the ways in which that benefits families and society and our economy. I mean, we could go on and on. And so I am really actually excited. I think there's a lot of momentum. There's a lot of fantastic partners. And having this report, having parents involved, to really continue to find opportunities for parents to speak directly to their experiences as we talk about these policy issues. It cannot happen soon enough.
Yeah, I will say that the Raising New York Coalition will be meeting next week and putting their finishing touches on our policy agenda, which will include a lot of these things. And I also need to say, in terms of poverty reduction, that EdTrust-New York runs the campaign for early literacy, and that is certainly a poverty reduction strategy. And early literacy does not start with pre-K, it starts at birth, if not before. So, Diana.
Hi, everyone. Thank you so much. My name is Diana. I work at Moms Rising, and I'm on the Empire State Campaign for Childcare. I do a lot of work with moms, and I read parent stories, and I connect with parents every single day. And I'm always struck by stories like yours, Amy, where it's not that you're not a hardworking parent that wants to get ahead. It's that you face barriers, and you describe them perfectly, so I'm not going to repeat them. But one of the things I often think about is our system is set so, like, if a mom is a little bit ahead, I'm going to say mom, right? A little bit. She found the job, and she gets a letter 2 weeks later to say, you found a job, so now we're going to take away childcare and cash assistance, and we're going to take all these things away. Guess what? The $15 hour job cannot, there's no buffer time, right? And then moms are like, I can't work too much, because if I work too much, all this assistance is taken away. So as a mother, as a parent, you're in an impossible situation, because you're like, I want to get ahead for my kids. I don't want to be on government assistance, because you already explained they make us feel so badly about accessing those systems and those services. So has there ever been discussion, or did it come up in the research or when you speak to parents about advocating for like a buffer time, right? Like moms need like 18 months, right, to create some kind of safety net so that you're not doing things like rationing diapers.
So I'm going to look to Jen to like fact check me again, but I do know from a Medicaid standpoint, and I believe that we need permission from the feds before this happens in New York State, but we are working towards automatic eligibility for 6 years. So if you're born on Medicaid, your Medicaid will stay until your 6th birthday. And that would be huge. We know that, again, I'm making up numbers, 75% of all babies at some point in the first 3 years of life are on Medicaid in New York State. And so those 75 would stay on Medicaid, which is meaning less paperwork every year, automatic eligibility. If by the time they're 4 and you're back to work and you've got a good job, you're not losing your Medicaid right away. That would be a huge win. And I do think that there's another, and I don't know what the status is of this, but if you get subsidy for childcare, there's a big push to have it be, if you get it, you get to keep it for 12 months before it goes away. And someone tell me if I'm fact checking. That's not in place yet? It's something we still want? Yeah. So, okay. We think it comes into effect this coming year, so that if you were successful in getting the subsidy and you got it in July, and you were on it, but let's say you actually get a better paying job in December, like you moved up, you got a raise, you wouldn't get dropped until it was the following July. Does that make sense? So those are 2 practical solutions, but I think that's just 2, and there's probably 6 more that also need to happen.
Can I respond to Amir? The other groups that might be affected, definitely going back to one of the bills, the minimum earnings bill. So that's we have providers talking about parents who didn't work enough or have enough hours or enough pay, worked below minimum wage, and they didn't qualify. How do you not earn enough money to pay childcare, and so you don't qualify for childcare? So that has to change. That group is there. And a slight correction, when I talked about the 6 to 12 weeks, believe it or not, that is for the new applicants. So what we did was New York raised how much you could earn to receive subsidy. That is the group that is having the 6 to 12 week issue. That group, not the group of parents who are already receiving subsidy. They have another set of issues. which the presumptive eligibility would help. When they have to recertify, we would like to presume that they're still eligible. Where in this world were you eligible yesterday, and when you have to recertify, you're not eligible? So that's why we need the presumptive eligibility to maintain, and that's why that group is affected. But the new people who just were told, hey, you can qualify now, you earn, I think it's below 90,000 now. And that's 6 to 12 weeks. So it's 6 weeks, but some people are experiencing 6 weeks double. Okay, so I just wanted to clarify that. So everybody's affected one way or other, right?
Any other questions? This side? No. All right, Amy, do you want the last word? You look like you might have something to say.
Oh, no, I was just.
Okay. All right.
Taking everything.
All right, then I'm going to thank everyone for coming here. And I'm sorry, I'm Jen O'Connor. If I don't know you, I hope I get to meet you. I'm with the EdTrust and Raising New York. And I do want to give a shout out to Alexa Recci, who is here from Assembly Member Andy Hevesey's office. He is our Children and Families Committee Chair, and he is one of the sponsors of the Working Family Tax Credit Bill. So I wanted to give him a little shout out. Thank you for being here. Thank you all for being here. Join our mailing list, and then we're gonna make the report available on the website today. So take a look at that. I'll remind you again, this was not a randomized control study. This was trusted partners going out into the communities and talking to a number of families who are unsung heroes and whose voices are not usually uplifted. So that's what we hope to accomplish. And I think we did. And I want to give a shout out to my colleague, Lara, in particular, for really shepherding for the last year and a half of this project. And again, to our funders and to EdTrust staff and to Arlen for making today possible. So thank you all. And we have this room for a while and there's plenty of vegetables. So please stay and talk to each other. Thank you very much.